Today we have with us Dr. Gururaja Rao, MDS, MSc London, FICD, FIAO MP, presently working as Professor, Head of Periodontics and Director Academic Affairs, JCD Dental College, Sirsa, Haryana. Past founder, Principal, Dayanand Sagar of Dental Sciences, Bangalore, has started postgraduate courses in KLE Society Dental College, Bangalore, AME Dental College, Raichur, Oxford Dental College, Bangalore. He is also past president of Indian Association of Oral and Maxillofacial Pathologists, Indian Society of Pariodontology, Indian Society of Dental Research, and he has also several recognition at India and abroad. Sir, please tell us about your textbook on periodontology, third edition, which you have brought out recently.
At the outset, let me wish all of you a very happy good morning, and it's indeed a great pleasure to introduce this book of periodontology, which has come into the limelight. Incidentally, this book is going to be published in January 2013. Indeed, the book has evolved at different stages during the last 20-25 years or so. I would like to tell you that the concept of writing a book started way back in 1980s, as a teacher at the College of Dental Surgery, Manipal, and when I had enthusiasm of training the poorest of the poor and the difficult students who were unable to absorb the knowledge of periodontology. That gave me an impetus by putting them some questions and making them write the answers accordingly. And it came up in such a way that the students managed to write the answers, and then finally it was corrected and it was made into a Xerox form or in a booklet form, and then eventually it became very popular in the form of question and answer text. Later, as you know, the second part of this was also improved eventually in 87 when I was in Manipal as well. However, the first edition of the book came up in 1998 when I was the founder principal of Dayanand Sagar College of Dental Sciences, and then it was in the first edition. Incidentally, the book was released by my own professor, Professor K.R. Devnath, and eventually we managed to run for the second edition, then second revised edition, and now it has the time that has come to have the third edition of the book. Yes.
Sir, what made you to bring out this third edition, and what are the benefits for the dental doctors community?
Yeah, incidentally, let me tell you, today periodontal diseases have become a great disguise. It's a sort of, not a boon, but mind you, let me tell you, it's a disguise on the people. Almost every individual in India suffers from periodontal diseases. Even just today morning when I was reading the American Academy of Periodontology bulletin, I was told that periodontal diseases have become so common in US also that every second individual suffers from periodontal diseases. That is the gravity of the problem. However, the book has been written basically for the practitioners, for the dental doctors, as well as the young upcoming students. There are books in periodontics. However, we have not been able to accumulate all the wealth of knowledge which have come from different sources. So here is an attempt which we have made to provide and comprehensive information to the students of periodontology, whether they are undergraduate students or postgraduate students. Incidentally, this book has been written from an angle for Indian students, basically because our Indian students have the ability to grasp what an Indian writes. Yes.
Sir, you told us about the contributors. Many have contributed to bring out this edition. Would you like to say something about contributors?
That's right. Yes. Incidentally, this book has been not written by me, but it is, I have edited the book. There are nearly 30 contributors all over the world. We have people from Hong Kong, we have people from America, we have got people from Australia, we have people from Saudi Arabia, we have people from Kenya, Libya, and all these places. Apart from that, from India, right from Trivandrum to Jammu and Kashmir, and from Guwahati, Assam to Bombay. So we have chosen people from length and breadth of the country and different parts of the world to make sure that our book has sufficient knowledge and will be able to provide the information to all of them. Yes.
Sir, when you approached the contributors, what you said, what were their reactions in the beginning and how they responded to your request?
Oh yes, many of them were very happy to contribute, yes. Incidentally, the whole concept of writing this book came up in December 2011 when I was attending the International College of Dentists meeting at New Delhi. Incidentally, that was an international meeting, and I had a good group of people who are periodontologists and who had gathered there. So my mind tried to give me some suggestion that, look, I could do something for my book, and I requested some of them to come forward to participate who really agreed for this program. And incidentally, today, as you have been told, nearly about 30 contributors are there in this field to help me in this regard. Yes.
So, would you like to acknowledge their efforts in this occasion?
Definitely, definitely. Incidentally, book writing is not one-man show. Incidentally, the contributors play a very important role in this process. I am sure we have eminent people from the field of periodontology, microbiology, from public health dentistry who have participated. At the outset, let me acknowledge the great role of Lakshman Samaranayaka, who is the Dean for the Hong Kong Dental School and who has participated in this program by writing his contribution about the candidal infections of the periodontium. Apart from that, we have also contributions from Libya by my colleague by name Suresh Bidumadav, who has done an immense role in writing a lot of topics for me. Apart from this, we have contributions from even Saudi Arabia. Fawad Jawad, who happens to be a PhD from Sweden, has given an immense role in this field as well. Yes, like that, there are so many people, and my own professor Neville Johnson, who has done a great help for me by writing introduction and forward for this book, who has been my teacher, my mentor, my philosopher. Presently he is working at the Gold Coast, at the university, and he is a great help to me, who is now presently settled in Australia. Yes.
So when do you expect this book to be out, hard copy I mean?
Oh yes, now as the part of the writing work is over, now the book has to be delivered to my publishers, and I'm told that it will take roughly about 3-4 months to complete, and it may be due by somewhere January 2013. That's what I'm told. Yes.
So thank you very much, Dr. Gururaja Rao, and it concludes our interview today, and we wish you all the best in giving the best advice to the young generation of dental doctors. Thank you very much. Sir, when this clinic was established, sir?
This clinic has almost 22 years of its existence. It started exactly on 20th of August 1990.
1990.
Yes.
Oh, since then this has been, you have been helping many people
Oh yes,
of
we
your
have
close
done
circle.
more about 10,000 people or even more. And incidentally, we have done almost over about 6,000 to 7,000 extractions. And no wonder we have been treating patients with periodontal diseases, dental caries, malocclusion, all those aspects, which is of great importance for public health.
It looks that this clinic is fully equipped with all the sophisticated instrument for a latest surgery.
Yes, we are occupying the space, make sure that people are benefited, and we have the uptrends of modern dentistry also, which has come into the limelight. And we got some instruments recently to equip ourselves to provide. Yeah, this is the reception lawn for the patients. Incidentally, we have provided the patients comfortable area for them to sit down, have a view of various information regarding dentistry, and we try to tell them about the various diseases that are existing in the man, and we try to inform them that the cause for the disease, and as well as we manage to treat these patients. Incidentally, dental caries, periodontal diseases are the greatest public health problems, and we are trying to make sure that we provide a good feedback to the patients for treating them. At the same time, we try to make sure that the patient tries to learn some amount of home care, which is a very important aspect, because unless and until the public health instructions are not followed, the dental diseases may not be curbed. That's the whole story, and we are trying to put it up in the patient's mind to a larger extent. Incidentally, this is the office of my dental chamber. We have a facility for getting information from different sources, and we try to make use of the latest information through internet, through as well as journals and all, which have been well equipped for our purposes, and we are trying to come up with new knowledge.